Spread the fire, feed the mind, grow the nation. Welcome to a guest analysis episode of SMWX. Today we're going to talk a little bit about the National Health Insurance, NHI. So what is the NHI fundamentally? That's a good place to start with the definition. The NHI is a National Health Insurance Fund. It's a fund. It's a pool of money that will be used by the state to purchase health services, to purchase drugs, and to actually utilize what are known as economies of scale to allow for ideally increased service provision within the South African space. So that's what it is. The NHI is a fund, and like any other fund, it's a pool of money. Now, what's the problem that the NHI is designed to solve? There are two problems. One is lack of access, and two is lack of funding. What do I mean by lack of access? As things stand right now, there is unequal access to premium healthcare in South Africa on the basis of race and on the basis of geographic location. 75% of Black South Africans utilize the public healthcare system, and 60% of colored South Africans utilize the public healthcare system. But when you juxtapose that to other races such as whites and Indians, you'll find that 85% of white South Africans utilize the private healthcare sector. That shows you that there's a big discrepancy between the provision of healthcare in terms of race. What about in terms of location? Over 40% of South Africans live in the rural areas. But in the rural areas, that's where only 12% of doctors work and only 19% of nurses. So when you think about that dynamic, it's easy to see lots of doctors in private health, in the private healthcare sector in the urban areas, lots of nurses in the urban areas and in the private healthcare system, but not a lot of people within areas where there's the biggest need. If you think about the nature of rural areas, what you'll find is that rural areas are oftentimes in need of emergency services, but those services are not available. And the hospitals and clinics that are nearest to the villages are not always the best resourced. So there's a lack of access issue. Then on the second side, there's a lack of funding. The lack of funding issue stems from the fact that the cost of healthcare in South Africa are actually quite prohibitive, but the amount of money that is coming from the national purse towards healthcare is comparatively small to the need. So in 2023-2024, what we saw was around 270 billion rands was allocated to healthcare. That is less than even the debt servicing costs that South Africa spends to service its debts. So healthcare is underfunded. By some estimates, you need about 500 billion rands per year to provide a superior quality of service. What's the challenge? The challenge is, as things stand, there's only one source of revenue, being that national purse. And when you look at the medical aid system, what happens there is people prepay into a pool of money, right, before they get sick, in order to allow for the economies of scale and in order to pool the risk. So that's basically how insurance works. But young people don't have a motive to do anything in the public healthcare system to prepay unless you actually mandate that through a tax system and through collection of those revenues. When you prepay, you increase the amount of money that the buyer of the healthcare services and commodities and goods has, and that allows them to have economies of scale, and that allows them to provide healthcare of a certain quality. And this is in the best case scenario. So that deals with lack of access, and that deals with the costing elements in terms of the lack of finances. The other issue that exists in the South African healthcare space is that of the number of healthcare practitioners. While there are some doctors who, after they've finished their medical school qualifications, do not get placed on time, South Africa does have a shortage of healthcare practitioners. If you go to Helen Joseph, if you go to Baragwana, if you go to Oliver Tambo Hospital, you'll see that there's a big shortage of doctors, and there's a manpower shortage across the board, whether it's nurses, doctors, pharmacists, you name it, there's a shortage. And to put that in perspective, when you look at the United Kingdom has 32 doctors per 10,000. When you look at the European Union, they've got over 40 doctors per 10,000, and South Africa only has 8 doctors per 10,000 people in the country. That's a discrepancy which is quite significant. And if you were to compare it to the UK, it's a 1 to the EU, it's a 1:5 discrepancy in terms of number of doctors. So there's a shortage of doctors as well. But at a healthcare level, in terms of the health of the community, there are other problems. The leading causes of mortality in South Africa, or morbidity even, are tuberculosis, diseases of the heart, diabetes, as well as violent crimes. So when you collect those together, you can see that there are multiple health challenges in South Africa, which are in part related to lifestyle. So the causes of some of these diseases have to do with alcohol consumption, they have to do with obesity in the communities, they have to do with high consumption of sugar and sugar products. And as a result of that, we see that the leading causes of mortality in South Africa are related to those things. So when you are trying to design a policy and to solve a healthcare problem, you have to, one, understand the causes, the root causes of the problem, as well as to try to design a system that solves that. So what the NHI is then most likely to be able to do is to solve the issues around provision of healthcare services within the urban areas where you already have hospitals and clinics. As a fund, it does not seem to have any direction that speaks towards increasing the quality of clinics and or hospitals in the rural areas of South Africa. So in that respect, there's a problem-solution gap. As things stand as well, there's nothing within the NHI that is going to address or mitigate the high consumption of sugar, the high consumption of alcohol, the extent of overweight people in the community. And as a result of that, it does not solve issues on the demand side. It may solve some of the issues on the supply side, but it does not necessarily solve issues on the demand side. If you build 1,000 hospitals, but you have 1 million people who are sick, right? You're still going to have a problem of having insufficient supply of hospitals, medical practitioners, drugs to deal with the population. And this is one of the challenges that exists within the South African framework. So that's fundamentally the long and short of the healthcare ecosystem and the reasons why the NHI is necessary. Just to give you some further context, the life expectancy at birth in 2021 for someone born in 2021 was 59.3 years for males and 64.6 years for females. The infant mortality rate was estimated at 24.1 per 1,000 live births. This is very far from the target. The target that comes from the National Planning Commission is that you actually want to have a life expectancy of 70 for both males and females. So you can see there's a discrepancy there, and men are dying much younger than women. What are the things that are killing men? Men are dying from HIV, they're dying from tuberculosis, they are also dying from diabetes-related diseases and also dying from cardiovascular diseases of various types. And those are some of the leading killers, but also from violent crimes such as murder. And women are dying, what we are seeing from the data, they're dying from the hands of men in the first instance, but also they are dying from diabetes and also other lifestyle-related diseases such as hypertension and cardiovascular diseases. So these are the leading killers of men and women in South Africa and in many other what they call low to medium income countries. And when we are talking about healthcare, we need to be thinking about, do all of our interventions solve these problems? Now, when it comes to can this be implemented in South Africa effectively, there is a real trust deficit between the government of South Africa, which is run by the ANC, and the general population. The general population is aware, for instance, that 1 billion rands was lost at the Tembisa hospital due to corrupt tender practices. The general public is aware that 431 million rands was lost due to the school fumigation scandal. If you recall, the Gauteng Department of Education fumigated schools to the cost of 431 million rands, even though the schools are closed and even though COVID does not last for a long period of time on surfaces. There have been a variety of healthcare scandals. If you recall, Royal Baca, 120 million. If you recall, Digital Vibes, that was also over 100 million as well. So there have been multiple healthcare scandals which have made people relatively concerned. If you remember the Life Esidimeni tragedy, where over 144 people lost their lives as a result of government negligence in the Gauteng Department of Health. All of these things are really the biggest hurdle to buy in South Africa for the national health insurance. The government does not have a track record of being able to execute things effectively at this particular point, and they do not have a track record of being able to manage finances effectively. And they have said that they will have a cost containment strategy as part of this particular national health insurance. There's a document which is known as the socio-economic impact assessment. And in that document, what government said about cost containment is that they will implement various measures to effectively control costs and to ensure that the NHI remains sustainable and affordable. The cost containment measures implemented will address both supply side and demand side constraints while ensuring that providers are fairly reimbursed for the healthcare services provided without compromising the quality of healthcare rendered to the population. This is something that is the premise of the rollout of the NHI, that there will be so many measures available to contain this and to make it an effective thing. But people have pointed out that Transnet collapsed very recently under the government. They've pointed out that the post office collapsed under the government. They've pointed out that the SAA in and of itself collapsed under the government. So therefore, it seems implausible at this particular point that even though Transnet, the post office, Eskom, and several other state-owned enterprises had crash landings, and many of them became semi-privatized entities, that the national health insurance will be something that will run effectively as desired and as designed, especially considering that there's a culture of tenderpreneurship. So many blessers have emerged from the ranks of the tenderpreneur community. The number of blessings that have been dished out in Sandton, Rosebank, Midrand, and Pretoria are exponential at this particular point. And this is what leads to the skepticism. From the healthcare practitioner side, there are some case studies that indicate that there's reason to move cautiously with this particular policy. In the United Kingdom, doctors have been leaving their jobs because they are not paid sufficiently and because they are frustrated with the quality of infrastructure and equipment that they have to use. And the United Kingdom has a very sophisticated healthcare system, but even in that system, people are leaving and walking away. And they are going into jobs either in the private sector in terms of other fields, and going also to Canada and Australia. It's very likely that if there's no buy-in from the medical community within South Africa, you will begin to see people moving out of the South African healthcare sector, going to Australia, going to Canada, and going to other places. Also, in the UK system, as things stand, there are high levels of waiting times before people can see specialists. So you see a GP, you have to get an appointment for that. Unless you have an emergency, then you go to the trauma ward, etc. But you have to go see a GP first, and then you get scheduled for a specialist. And some people have been waiting close to a year to see a specialist to then have their procedure sorted out. So there are real issues around the quality of service and whether or not this will deliver as desired. And if doctors think that they're not going to get their payments on time, if they think that there's going to be a deterioration in the quality of their workplaces and there's going to be a deterioration in their working conditions, there's a very real risk that the doctors and nurses of South Africa will begin to look at their prospects. They've already been leaving. I was in medical school for a very short period of time, and some of my colleagues who I studied with are now working in the UK, in France, in Germany, Germany, and several other places around the world. Canada, I think I saw some guys, and also America. So there's a real risk that people will leave, and some people are already leaving because the US dollar, the Canadian currency, and the UK pound are relatively stronger than the rand and more desirable. But this could lead to uncertainty within the medical community, which would make them leave. Let's imagine, however, a best case scenario. A best case scenario, if the ANC is able to execute this flawlessly, is that finally people will be able to achieve universal healthcare. You will be able to get more healthcare than has been available before, and to be able to get specialized healthcare than has been available before. And considering the apartheid structure of South Africa and the divisions, which even include the provision of healthcare, that could be something that is positive. So the promise of the national health insurance is quite high, and the principles of the national healthcare insurance, that all are equal under the constitution, and really even in reality we should all be equal. And if all are equal, all should receive the same quality of care and services. The real hurdle is going to be how this is going to be implemented. It seems as if Discovery sent a communique to its medical aid members saying this could take as much as 10 years to be fully implemented. So even though this is signed now, there are still many legal hurdles ahead in order for this to become a reality. But what do you think? Do you think that those who are skeptical of the ANC and the NHI are unjustified in that skepticism? Or do you really think that right now the level of distrust is warranted considering the track record of this administration? Many are also saying, listen, when NSFAS was introduced, there was resistance. When UIF was introduced, there was resistance. But others are still saying that the timing of the introduction of this policy is questionable, because this policy is being introduced 2 weeks before the election, and potentially could be really an election play by the ANC, by President Ramaphosa. But I'm really curious, what do you think? Let's have a conversation. Let's meet in the comment section. Subscribe, like, comment. I'll be in the comments checking what you guys say. Till the next one. Aye, yay.